Hi, good morning everybody. This is Health Honestly. I'm Dr. Bruce Charlesworth. I was reflecting on the way in which the GP communicated with me yesterday when I had my health check, and there's just something that I wanted to share. And it's a question that comes up a lot, which is, why did I stop practicing medicine? I argue that I kind of didn't, but I guess why did I come out of the mainstream NHS and give up doing what I was doing? And there's a message in here, I think, for a lot of healthcare professionals, and this is not meant to patronise, but I just wanted to share my experience. So there were three things that happened when I worked in the NHS, each of which had a really profound impact on me and made me think, that's not right, that's not the career I want. The first thing was when I watched a surgeon once walk into a clinic and say to a small boy, without any context really, when he was there with his mum, it needs to come off here. It needs to come off here. And he was referring to his arm, in which he had a tumour. And this poor kid had no idea that was coming. The mother had no idea that was coming. And I watched that message be delivered. And I just thought, I will never do that. I'll never communicate like that. And I'm not saying that's what all healthcare professionals do, but that shocked me. The second was when I was an anaesthetist, so practiced as an anaesthetist for a number of years, and I used to always go and see the patients afterwards. I used to go down to the ward and I used to ask them, and I used to say, how was your experience? What was it like? Have you got any pain? Can I help with anything else? And one of the consultants said to me on one day, why do you bother doing that? I thought that was a really interesting phrase, and I said, why do I bother? Because I'm bothered about the service that I'm offering. At the end of the day, I'm a service provider. I'm here to make a patient feel good. I'm here to help them have their operation and help them recover. And why would I not be interested in that? And he said, oh, it's just, we don't really have time for that kind of thing. And I've always stuck to the fact that you need to do like a review afterwards and figure out and improve yourself. So I think that's a really bad thing to say, that you shouldn't spend the time afterwards looking at your practice and what you've done. And then the third thing that happened was to do with a patient in the operating theatre, and I was given a particular anaesthetic, and the surgeon said to me, I don't care what anaesthetic you give them, I just need them asleep because I'm going to teach. And I said, well, that's not the best thing for that patient. And I decided to do what I wanted to do, and I said, look, I'm going to do the right thing. I'm not going to do the most convenient thing. Now, I'm not saying all of these things are traits of healthcare professionals at all, but I think there has been historically a bit of arrogance in healthcare professionals. I want to break that. So my message here is to patients and also to healthcare professionals is, just remember, we're all human beings. At the end of the day, healthcare professionals like me, all I have is a degree in medicine and my experience. That's all I've got above anyone else. I don't have superpowers. I'm not some amazing human being that can do incredible things. I just know a lot about a specific topic. But a lawyer knows about law. An engineer knows about engineering. Welders know how to weld. Have the respect for other careers. Everybody has their place in society. Everybody has their speciality. So as a patient, make sure you choose your healthcare professional wisely. And my ask to all healthcare professionals is just be nice. Be nice, use your skills, but remember, at the end of the day, the psychological impact that we have every day when we're speaking to and engaging with patients is absolutely insurmountable. It's massive, and actually communication is the key to a lot of healthcare, be it bad news, be it good news, be it dismissing someone, be it someone who's injured themselves, has been involved in whatever they've been involved in. I think we owe it to one another to communicate. So please, if there's one message today, it's be nice, look after one another, and let's create a more healthcare aware world. I think humility is really important. So this is Bruce Charlesworth, this is Health Honestly, and we always speak the truth. As ever, I'll speak to you soon.